Mr. President, I rise today to pay tribute to one of my personal heroes, Justice Ruth Bader Ginsburg. She spent her life in service to the American people, quite literally. Whether the Supreme Court was hearing arguments about civil rights, reproductive rights for women, protecting our environment, our precious water and air, or standing up for our workers, Justice Ginsburg could be counted on to put the needs of the American people first, every time. She might not have looked like much of a fighter in the lace collar, punched far above her weight. The American people were so fortunate to have her on their side of the ring. I feel fortunate as a woman in America, my daughter, my granddaughters, to have known she was there over and over again, fighting for us. And that certainly was the case on health care. You know, I've said over and over again on the floor of the Senate that health care isn't political, it's personal for each one of us. It's personal. Justice Ginsburg understood that in her bones. As a person who had experienced her own health challenges and health challenges in her family, she knew that when a beloved spouse is diagnosed with cancer, or a child has a fever and needs to go to the emergency room, politics is the last thing on your mind. When people tell me their healthcare stories, they don't start by telling me whether or not they're a Democrat or Republican. That's because when it comes to healthcare and the health of their families, it simply doesn't matter. People in Michigan just want to know that if they or their loved ones get sick or are hurt, they're going to be able to take them to the doctor and get the health care that they need. Unfortunately, with the loss of Justice Ginsburg, Michigan families and families all across the country have extra reason to be very concerned right now. 1 week after the election, just 1 week after the election, the Supreme Court will hear arguments in the case that could overturn the Affordable Care Act, overturn everything. All of the protections, including, of course, pre-existing conditions coverage. All of it. And by the way, the President of the United States, President Donald Trump, has weighed in favor of having that happen. Everything is at stake, everything, including coverage for 17 million people through the expansion of Medicaid, where minimum wage workers right now in states like Michigan that have expanded Medicaid no longer have to pick between a minimum wage job and not working and having health care. So important. Also, the ability for children to remain on their parents' health plans until age 26 has transformed so many families' opportunities, young people's opportunities. Coverage for preventative services like cancer and maternity care. Prior to the Affordable Care Act, you know, you had to get extra coverage for maternity care. It wasn't viewed as basic, pretty basic. For me, when I was having my children, for women across the country, pretty basic. Wasn't viewed as basic essential services. It now is under the Affordable Care Act. Mental health care, treatment for substance use disorders, lowering prescription drug prices for seniors, protections for people with pre-existing conditions. It's estimated that about half of Michigan families include someone with a pre-existing condition. Everything from heart disease to asthma to high blood pressure to cancer. Nationwide, we're talking about 130 million people, 130 million people. And how many more people now, after COVID-19, will have a pre-existing condition? In other words, what happens in the next few months, what happens in terms of filling another Supreme Court vacancy, as well as what happens in the election, could have life and death consequences for Michigan families and families across the country. In case anyone has forgotten, we're in the middle of a once-in-a-lifetime pandemic. More than 200,000 Americans have already lost their lives, and unfortunately, that number is going up every single day. In my own state, nearly 7,000 people have lost their lives. 7,000. Moms and dads, grandpas and grandmas, brothers and sisters, children, friends. And even those who have survived COVID-19 may be left with long-term health issues, from heart damage to breathing difficulties to neurological problems, and as I said before, pre-existing conditions. This is not the time to be ripping healthcare away from American families. There's never a good time, but certainly not now. Yet that's exactly the scenario we could be facing. As Justice Ginsburg said, healthcare is not like a vegetable or other items. One is at liberty to buy or not to buy. When a Michigan single mom discovers a lump and finds out that she has breast cancer, she can't just hope it away. When a Michigan senior with diabetes needs insulin, he can't just wait for a big sale and stock up when the price is right. And when a child spikes a high fever in the middle of the night, her parents can't just tell her, well, you know, the money's tight right now, so you're going to have to wait to see a doctor. I mean, that's the horror for all of us as parents, that our child will get sick and we won't be able to take them to the doctor. Healthcare isn't political, it's personal. It isn't about policy, it is about people. People. It's about the people in our states who sent us here to fight on their behalf. I sincerely hope that there will be the time, that by the time the Senate votes on the next Supreme Court justice, if unfortunately it comes before the people have their say about who should be making that nomination and confirming that appointment. If that is going to be rushed through, jammed through by this Senate, I hope that there will be 4 United States senators on the other side of the aisle who will have the courage to stand up for people who need health care. And frankly, that's all of us. One thing I do know for sure is that the American people are courageous. Time and time again, they've called us and written letters and even come to DC to make their voices heard, from the amazing little lobbyists to ALS warrior Adi Barkan, to my friend Lauren Kovac, who fights so hard to find a cure for Alzheimer's disease and other dementias. These folks would probably rather be spending their time doing something else. But they understand that healthcare isn't a luxury. It's a necessity. It should not be political. It is personal to each and every one of us. Again and again, people across the country have stepped up. They've gotten engaged. They've put their passion to work protecting our health care. Their voices, the voices of millions of Americans, made the difference in this chamber. The majority in this chamber saying no to repealing the Affordable Care Act and ripping health care away from millions of Americans. And that only happened because people stood up and made their voices known and were actively engaged in saying what was important for them and their family. You know, it's easy always to throw up our hands and give in. It'd be easy to let the sadness and tiredness and feelings of loss for Justice Ginsburg and all of the frustrations and the chaos that has happened to take over all of us. But RBG never let that happen. No, if she was here right now, she would say, no, no, no. This is the moment to focus and engage and to fight even harder. when, as a Harvard Law student, she was asked by the dean why she felt entitled to take a slot that otherwise would have gone to a man, she didn't let that faze her. When she struggled to land a job with a law firm after graduation, she turned to teaching at Rutgers School of Law and hid her second pregnancy under baggy clothes until her contract was renewed. She later challenged the New Jersey law that forced pregnant teachers to quit their jobs. And when she was diagnosed with cancer for the first time in 1999, she fought back and kept on fighting for more than 20 years. It's time now for us to fight, all of us who care about our freedoms and rights and our very way of life in this country. It's time to fight like our beloved RBG, like she did every day of her life for us. Justice Ginsburg once said this: fight for the things that you care about, but do it in a way that will lead others to join you. I'm asking the American people right now to join us in this fight. This is not a done deal. It is not over. And we all, as senators, we will be held accountable for what we do. Call your senators, write emails and letters, talk to your friends and neighbors, let them know what is at stake. From health care and reproductive rights for women, to protecting our air and clean water, to the capacity to be able to collectively bargain for wages and safety and benefits, to voting rights, civil rights. We could go on and on and on. It's all on the line right now. We need to step up and fight and not assume anything's a done deal. We need to hold our Republican colleagues accountable. Don't let them get away with taking health care away from millions of families. We did it before when we stopped the repeal of the Affordable Care Act. And I think we have to fight now to do the same thing. And vote like your life and the lives of your family depend on it, because they actually do. Justice Ginsburg dedicated her life to making our country more fair, more free, and more just. Now it's time to continue her fight for our future, for our children, for our grandchildren. Thank you, Mr. President. I yield the floor.